36-year-old male with a lump behind the right knee that he's had for several years, but getting a little bit bigger over the past several days after a long car trip. He was concerned about it. He had no fever, chills, or chest pain, or shortness of breath. Did an ultrasound, which essentially showed a ganglion just posterior to the semimembranosus tendon, and reassured the patient that doesn't have to worry about it. Here's just a quick overview of the anatomy of this ganglion in the back of the knee. We're rotating the knee, and we can see this ganglion on the posterior aspect of the knee in the popliteal fossa, essentially sitting right on top of the semitendinosus tendon. Couldn't make out a septum here in the distal quarter or so of this ganglion. We're rotating now to see it from the side. And here again is just a view of it from somewhat of a distance. 36-year-old guy with a cyst here for a couple of years. Got a little bit bigger after a long car trip about 5 days ago. So there was no injury, and this basically happened after a long car trip where he noticed that this lump was becoming bigger behind his right knee. He had no signs of fever, shortness of breath, or any kind of chest pain. So here's our first view. It's a sagittal scan in the posterior medial aspect of his right knee. You can see the ganglion sitting right above the semimembranosus tendon. You can see how that tendon feeds right into the muscle. It's got pretty thick hyaline cartilage over the medial femoral condyle, which you can tell with ultrasound. Also, you can appreciate a septum within the cyst, separating it into two different parts, which is common for ganglions. And here's just to demonstrate that you can see artifact in the knee crease, and you shouldn't mistake that black stripe going down for any kind of cyst. And here we are going a little bit further distal. We can see the semimembranosus tendon inserting onto the tibia. And also that thinner semitendinosus tendon is right above the semimembranosus tendon. And at the top right corner of the screen, you can appreciate the ganglion. Here we are, we're going to an axial view, and you can see how the semimembranosus tendon sits right below that ganglion. And you shouldn't mistake this for a Baker cyst, as its location is proximal medial to a Baker cyst. And also you don't see that typical stalk or communication tract between the semimembranosus tendon and the medial gastrocnemius tendon.